Hey y'all, I'm Dr. Jericho with Plume, and today we're going to be walking through the basics of injections. Injections are one of the ways that you can take gender-affirming hormone therapy, and we do tend to get a lot of questions about them. But before we get started, I just want to say that you are valid, you are loved, your journey is valid, and no matter what that journey looks like, at Plume, we're here to support you. So let's get started. So first, we're going to walk through the process of gathering your supplies and preparing your space. This is a really important first step, whether you're giving your first injection or your 100th injection. It's something that I always make sure I do when I'm giving an injection to either myself or a patient. Now, another thing that's really important and helpful is to give yourself plenty of time. If you're not feeling rushed through this process, it'll be a lot easier to remember all the steps and the details, and also ensure that your body is relaxed as possible, which is really important when you're giving yourself an injection. Now, another thing that could be really helpful is just make sure you take a big, deep breath before you get started. So if you want a deeper dive into all the different injection supplies, how to find your dose, and step-by-step injection tutorial videos and other information, you can go to our website at getplume.co. All right. Now that you have everything laid out, let's just walk through and make sure you have what you need so you don't have to grab something later right when you're in the middle of your injection process. Everybody's setup is going to vary a little bit based on what you discuss with your provider, but it should generally look something like this. So for one, you're going to need your syringe to draw up the medication. You're going to need 2 needles. One is your draw-up needle. You're going to need your injection needle. And then 2 alcohol swabs, of course your vial of medication, and you can't forget your fun, cute Band-Aid with smiley faces on it. Now, as far as understanding your medication dose, it can be a little intimidating if you're not used to it. The vial itself is going to have the concentration of the medication. The place you're going to find your actual dose, or the milliliters that you need to inject, is going to be on the box that the vial came in, or you can double check our secure patient communication app and look at the message from your provider which details your prescription. Now, as far as syringes go, you do have to be careful because most of the time they do come in milliliters, but sometimes they can come in units. And you'll just want to look at the syringe and confirm with the pharmacy of which one you have. So the syringe that we recommend is a 1 milliliter syringe. And you can see that it is marked in 0.1 milliliter increments from 0.1 all the way to 1. And these are great because you're never going to be giving yourself a gender-affirming hormone therapy injection more than 1 milliliter. Now, syringes can also come in 3 milliliters. These are fairly common. Sometimes the pharmacy will give this to you, and you can see the increments are marked out in half milliliters, so from 0.5 milliliters all the way to 3 milliliters, but the smaller 0.1 milliliter marks are not labeled. And so you do have to be careful and just make sure that you're drawing up to the right line, but you can definitely use these. And as I mentioned, they'll sometimes give you an insulin syringe. These can be used as well, but different from our 0.1 milliliter increments on the 1 milliliter syringe, they'll go from 10 units all the way to 100 units. And each of those 10 unit increments are equal to 0.1 milliliters. So again, they can be used, but you just want to confirm with the pharmacy that those are in fact equivalent to a 1 milliliter syringe. Now, another pro tip about syringes is that some come with a luer lock tip, as you can see here. We prefer these. It has these little grooves so you can lock in the needle when you put it onto the syringe. But sometimes the pharmacy will give you what's called a slip tip syringe. You can use these as well, but you can see there's no locking mechanism. So you just gotta be extra sure that that needle is on there nice and tight. All right, so once you've drawn up your medication and you switched over to your injection needle, you're ready to go. So I'm gonna use this syringe to demonstrate where you can give yourself an injection. Now, there's 2 different types of injection. One is an intramuscular injection, which goes into the muscle, and the other one is a subcutaneous injection, which just goes right underneath the skin. For an intramuscular injection, there's a few different places you can give this, but when you're doing it yourself, the easiest and safest place to inject is going to be on your upper outer thigh. So about right here. And when you're giving yourself a subcutaneous injection, there's a couple options. Again, you want to do what's easiest, what's right in front of you, and so that's going to be your belly. You can take a pinch of skin and give an injection there. And you can also take a pinch of skin on your leg as well and give an injection there. And once you finish your injection, you want to make sure you dispose of your supplies appropriately. And so you want to put all of your sharp needles into a hard-sided container that can be sealed. You can get actual medical grade sharps boxes from most pharmacies or a medication supply company, or you can also simply find some kind of hard-sided container around your house, such as a laundry detergent container, or in this case, an old plastic jar that you can drop your needle in. Make sure you seal it up so you can use it later, and you're good to go. If you're not sure that injections are right for you, that's okay. There's lots of other options out there, and our providers at Plume can help you walk through those options and find the one that works best for you. So thank you for watching. If you want to learn more about gender-affirming hormone therapy at Plume, our other services that we provide, the states that we're in, and more, you can go to our website at getplume.co. And if you want to get started, just click on the link in our bio. We'll see you there.